Hey, my name's Kim. I've been an ER nurse in the ED at San Francisco General for about 5 years, and I was asked to briefly speak on staffing and safety, so it's going to be a little repetitive. But safety obviously is a hot topic at SFGH right now, especially surrounding the events that happened with the recent attack of the elderly patient in the ED. And I would like to stress that this event should not be viewed as an outlier. With the patient population that we do see in the ER, situations frequently escalate and violence often results. Much of this violence, often physical, is aimed at and falls on nurses. I think myself and many of my coworkers often see violence in the ER at ourselves and other patients. So this event was not an outlier. There have been violent assaults on other patients, by patients, and on ourselves. This phenomenon has only worsened in my 5-year tenure in the emergency room as numbers and staffing have declined. We wanted to register with you all today that we believe safety for patients and staff is not solely a security issue, but relates to staffing as well. Managing emotionally unstable or clinically agitated patients can be better with adequate staff. Working within state-mandated ratios, nurses have time to recognize signs that patients are having difficulty coping. They can intervene sooner to de-escalate a situation that may have otherwise resulted in violent behavior. As simple as it sounds, having adequate staff, including ancillary staff, helps get patients to where they need to be so patients on 5150 holds that have been medically cleared are not waiting around to be transported to psych services. This helps keep things calm in Zone 1, which is our trauma critical care zone. This is not even close to happening at current staff levels. What's even more concerning is that under the current budget, if we filled all the open positions in the ED, we would still be short-staffed and at risk for more violence towards ourselves and our other patients. I've also been asked to add that we have reviewed subcommittee minutes that indicate there are no beds closed in the ED due to staffing issues, and this is not what we are seeing in our daily practice. Closing beds in the emergency department in order to support the clinical decision unit has become daily practice. Closing additional beds to account for our lack of nursing staff also happens daily. Reducing the number of beds in these less acute zones pushes more traffic into our trauma zone. Overloading our trauma zone leads to extended hours on divert and impacts our ability to provide adequate patient care and ensure patient safety. Thank you.